RN Link presents Understanding the Clinical Documentation Integrity for Acute Inpatient Rehabilitation. The presentation offers one CEU approved by BRN, ACDIS, and AHIMA. At the end of the video, we will provide instructions on how to obtain the CEU for a fee. Learning Objectives. Upon completion of this presentation, participants will be able to explain IRF-PAI 60% rule and the role of CDIS. Describe the Impairment Group Code, IGC, Rehab Impairment Category, RIC, and how these differ from MS-DRG and the MDCs. Describe etiologic diagnosis, comorbidity tier, functional independence measure, FIM, case mix group, CMG, and quality indicators. Understand how to utilize evidence in the medical record to formulate compliant rehab queries and educate the providers. IRF-PAI 60% rule. Inpatient Rehabilitation Facilities Patient Assessment Instrument, IRF-PAI. If an IRF admits greater than 50% of Medicare fee-for-service or Medicare Advantage, it must then comply with the following. 1. At least 60% of the total inpatient population must have required intensive multidisciplinary rehab services in 13 listed conditions. 2. The calculation include Medicare patients and others. 3. Both primary and comorbid conditions are included. What are the 13 qualifying conditions for 60% rule? 1. Stroke. 2. Congenital deformity. 3. Spinal cord injury. 4. Amputation. 5. Brain injury. 6. Multiple trauma. 7. Hip fracture. 8. Burns. 9. Neurological disorders. 10. Active arthritis. 11. Systemic vasculitis with joint inflammation. 12. Severe or advanced osteoarthritis. 13. Knee or hip joint replacement. Note: Asterisk diagnosis has additional guidelines apply for inpatient rehab services. What is Impairment Group Code, IGC? 1. IGC. Item 21 on IRF-PAI, best describes the primary reason for the admission to IRF. 2. Similar to principal diagnosis used in acute care setting. 3. Be as specific as possible in selecting the IGC. It affects CMG, reimbursement, and ELOS. 4. For most cases, the IGC at discharge is the same as admission IGC. Impairment group codes are grouped into 17 categories. 1. Stroke. 2. Brain dysfunction. 3. Neurological conditions. 4.1. Spinal cord dysfunction, non-traumatic. 4.2. Spinal cord dysfunction, traumatic. 5. Amputation. 6. Arthritis. 7. Pain syndromes. 8. Orthopedic disorders. 9. Cardiac. 10. Pulmonary disorders. 11. Burns. 12. Congenital deformities. 13. Other disabling impairments. 14. Major multiple trauma. 15. Developmental disability. 16. Debility, non-cardiac, non-pulmonary. 17. Medically complex. Rehabilitation Impairment Category, RIC. For the purpose of billing, RIC classifies patients with similar IGC into same category, IGC equals RIC, in most cases. Think of RIC as similar to major disease classifications, MDCs. There are 21 RICs. RICs are the first level of classification for the payment categories. RIC is not recorded on the IRF-PAI but is automatically assigned by the grouper software. Rehabilitation Impairment Category List. 1. Stroke. 2. Traumatic brain injury. 3. Non-traumatic brain injury. 4. Traumatic spinal cord injury. 5. Non-traumatic spinal cord injury. 6. Neurological conditions. 7. Fracture of lower extremity. 8. Replacement of lower extremity. 9. Other orthopedic. 10. Amputation of lower extremity. 11. Amputation of non-lower extremity. 12. Osteoarthritis. 13. Rheumatoid, other arthritis. 14. Cardiac. 15. Pulmonary. 16. Pain syndrome. 17. Major multiple trauma without TBI or SCI. 18. Major multiple trauma with TBI or SCI. 19. Guillain-Barré syndrome. 20. Miscellaneous. 21. Burns. Etiologic diagnosis. Etiologic diagnosis is the problem that led to the condition for which patient is receiving rehab. Example: a patient with acute ischemic stroke with left-sided hemiplegia received acute care and now admitted to rehab due to hemiplegia to help the patient adapt or regain motor function. IGC, left-sided hemiplegia, IGC 1.1, left body involvement, right brain. EDX, acute ischemic stroke, ICD-10 code I63.9. This must be documented by the provider. The codes are based on ICD-10 codes. IGC and Etiologic Diagnosis Practice Quiz. Mr. Smith is a 70-year-old with complex medical history including TBI, CHF, CKD, multiple falls, admitted after a fall at home with displaced intertrochanteric fracture of the left femur. Status post-ORIF of left femur prior to admission to acute inpatient rehabilitation. What is the IGC? A. Hip fracture. B. TBI. C. ORIF of left femur. What is the etiologic diagnosis? A. TBI. B. Fall. C. Displaced intertrochanteric fracture of the left femur. See next slide for the correct answer. Comorbidity tier. Comorbid/secondary conditions a patient may have that are impacting the rehab are categorized into tiers. Think of comorbidity tiers as similar to MS-DRG MCC/CC. The tiers are as follow. Tier 1, B tier highest weighted tier. Tier 2, C tier moderate weighted tier. Tier 3, D tier lowest weighted tier. No tier is represented in the CMG with letter A. The comorbid conditions must be accurately documented by the provider. Coding considerations. Comorbidity tier diagnoses is where the CDIS may have query opportunities. Tiers do affect reimbursement. Current conditions need to be documented by the provider as well as prior level of function and current level of function to obtain the most accurate FIM scores. See following slides. Any resolved conditions should not be added into the comorbid diagnoses. Example is acute respiratory failure with hypoxia was noted during the acute inpatient episode. However, the acute respiratory failure diagnosis was resolved by the time the patient was admitted to the post-acute rehab unit. For etiologic diagnosis, keep in mind that trauma diagnoses will be listed within the trauma category and procedures are not etiologies. When coding a post-acute rehab medical record, start with etiologic diagnosis, then identify the Impairment Group Category, IGC. Functional Independence Measure, FIM. FIM score instrument is a basic indicator of patient disability. It's used to track the changes in the functional ability of a patient. The FIM admission assessment is done within 72 hours of start of rehab. The lowest score of any 24-hour period is recorded on the IRF-PAI by the 4th day. Discharge FIM assessment score is collected within 72 hours prior to discharge. FIM comprised of 18 items, grouped into 2 subscales, motor and cognition. 12 out of 13 motor scores are used as final part of all the CMGs in all the RICs. It helps to determine the reimbursement in all the RICs. Cognition scores only help in determining reimbursement for RIC 01, stroke, and 02, traumatic brain injury. CDI need to review all the records to make sure that only the lowest FIM of the first 72 hours of admission are recorded in IRF-PAI. FIM instrument could be entered by any trained clinician, examples, nurses, PT, OT, etc. Remember, different environments or times of the day could affect patients' function. Please record the lowest rating. The FIM focuses on what a patient is doing or does and not what the patient should be able to do. It's imperative that the CDIS review the nurses' and therapists' notes to make sure that the lowest scores were recorded. FIM motor versus cognition items. Motor items. Eating, grooming, bathing, dressing upper body, dressing lower body, toileting, bladder management level of assistance, bladder management accident frequency, bowel management level of assistance, bowel management accident frequency, transfers, bed, chair, wheelchair, transfers, toilet plus walk/wheelchair plus stairs. Transfers, tub, excluded in determining the CMG. Cognition items. Comprehension. Expression. Social interaction. Problem solving. Memory. Case mix group, CMG. Distinct groups used in classifying patients based on clinical characteristics and expected resource needs. CMG determines the reimbursement to IRF, similar to MS-DRG. It comprises of a letter and 4 digits, example, B0303, non-traumatic brain dysfunction with AB tier. As illustrated below. B is the tier. 03 is the RIC. 03 is the weighted FIM score. Special CMGs. 5 special CMGs. 1. Short stay, LOS less than 3 days is 5001. 2. Expired, orthopedic, LOS less than or equal to 13 days is 5101. 3. Expired, orthopedic, LOS greater than or equal to 14 days is 5102. 4. Expired, non-orthopedic, LOS less than or equal to 15 days is 5103. 5. Expired, non-orthopedic, LOS greater than or equal to 16 days is 5104. Note: expired, patient died during inpatient rehab services. Quality indicators, QIs. Quality indicators are now a big part of the IRF-PAI starting October 1, 2016. Every IRF must accurately complete each section of the QI in a timely manner. The CMS provides the guidelines and the rubric for scoring each section of the QI. A facility will be assessed 2% penalty for the year if it fails to comply with any section of the QI. CDI must pay attention to make sure every condition that is POA is documented as such. Formulating compliant queries. Case 1. Mr. Johnson is a 68-years-old African American admitted with traumatic brain injury after a motor vehicle, auto versus pedestrian, accident. Patient was initially treated in the intensive care unit and now admitted to acute rehab for intensive multidisciplinary rehabilitation therapy. Assessment/plan. 1. Traumatic brain injury. 2. History of CHF, last known EF, 45%. 3. Swallowing difficulty, speech therapist recommends pureed diet with thickened liquid. 4. Gait instability. 5. Hypertension. 6. Migraine. Based on the documentation, the provider was queried by the CDIS with regards to the swallowing difficulty and the type of CHF. Provider's response: dysphagia, C tier, and systolic CHF, D tier. CMG before query is A0207, after query is C0207. ELOS before query is 19 and after query is 23. Relative weight before query is 1.6911 and after query is 2.0255. Reimbursement before query is $26,783.64 and after query is $32,079.87. Difference before query is negative $5,296.23 and after query is plus $5,296.23. Sample query for Case 1. Place patient name, date of admission. Dear Doctor/Provider, place the name. Clinical documentation/information on the patient's record indicates swallowing difficulty. For accurate Impairment Group Code, the Comorbidity tier, and the CMG assignment to reflect the level of rehabilitation services provided, could you please select all the diagnoses that apply to the patient based on your clinical judgment? Dysphagia. Aphasia. Aphagia. Swallowing difficulty without further diagnosis. Other, please specify, so provider can respond his answer if not in the choices. Provider needs to sign, date and time it. List the clinical documentation found in the record like from progress notes, etc. Lab results. Diagnostic workup. Extended length of stay. Therapists/nurses documentation. Increase in resource utilization. Other. Place your name and place your title, CDS, date and time. Case number 2. Mr. Jones is a 63-years-old Caucasian male admitted to the acute rehab due to paraplegia secondary to traumatic spinal cord injury at L1. Patient was initially admitted to the hospital on April 1, 2017 and transferred to the rehab on April 7, 2017. Patient will require multidisciplinary rehabilitation care in order to help him maximize his functional status before going home. Assessment/plan. 1. Paraplegia. 2. Status post-fall. 3. Intermittent AMS. 4. History of hypertension. 5. DM type 2. On insulin sliding scale. 6. History of cataract surgery. Based on the documentation of the history of DM2, insulin sliding scale, and the blood sugar level below, CDI queried the provider. Blood sugar from Acute checks as follows. 176 mg per HL, high. 237 mg per HL, high. 228 mg per HL, high. 234 mg per HL, high. Provider's response, DM2 with hyperglycemia. CMG before query is A. 0404, after query is D0404. ELOS before query is 27 and after query is 31. Relative weight before query is 2.5776 and after query is 2.8512. Reimbursement before query is $40,824.03 and after query is $45,157.31. Difference before query is negative $4,333.28 and after query is plus $4,333.28. Sample query for Case 2. Place patient name, date of admission. Dear Doctor/Provider, place the name. Clinical documentation/information on the patient's record indicates abnormal blood sugar level and type 2 diabetes. For accurate Impairment Group Code, the Comorbidity tier, and the CMG assignment to reflect the level of rehabilitation services provided, could you please select all the diagnoses that apply to the patient based on your clinical judgment? Hyperglycemia. Hypoglycemia. Elevated blood sugar without clinical significance. Type 2 diabetes with diabetic complication, please specify the complication. Type 2 diabetes without diabetic complication. Other, please specify. So provider can respond his answer if not in the choices. Provider needs to sign, date and time it. List the clinical documentation found in the record like from progress notes, etc. Lab results. Diagnostic workup. Extended length of stay. Therapists/nurses documentation. Increase in resource utilization. Other. Place your name and place your title, CDS, date and time. These are the references used for this presentation. Thank you for watching. Don't forget to click subscribe, follow and like buttons to get the latest updates. For $20, click or copy the link below for 1 hour continuing education.